Welcome to the COVID-19 Town Hall hosted by the North Carolina Department of Health and Human Services and Alpha Kappa Alpha Sorority Incorporated, Beta Iota Omega Chapter in Greensboro, North Carolina. I am Crystal Boyce, President of the Beta Iota Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. Our chapter is comprised for Alpha International Health and Wellness and Global Impact. The COVID-19 pandemic has impacted our lives in various ways, and today we will be informed by top officials regarding next steps in the state of North Carolina. I have the distinct pleasure to introduce our Mid-Atlantic Regional Director of Alpha Kappa Alpha Sorority Incorporated, Ms. Jennifer King Congleton, to provide a special greeting. Ms. Jennifer King Congleton is a passionate leader with a heart for community service, philanthropy, and education. For over 40 years, Ms. Congleton has been a dedicated member of Alpha Kappa Alpha Sorority Incorporated, serving faithfully on the local, regional, and international levels. Professionally, Ms. Congleton is an administrator of chaplaincy and volunteer services at Vidant Medical Center, where she is responsible for leading the hospital's pastoral care department and approximately 345 volunteers. I now present to you Ms. Jennifer King Congleton. Welcome.
Good evening, President Boyce, and thank you. Greetings, everyone in Guilford and surrounding counties. I bring you greetings from the marvelous Mid-Atlantic region of Alpha Kappa Alpha Sorority Incorporated, which is made up of 10,000 active sorority members in the states of North Carolina and the Commonwealth of Virginia. The Mid-Atlantic region is the home of the Beta Iota Omega Chapter, your host chapter for this very important COVID-19 town hall on this evening. Also the home of the 4th Mid-Atlantic Regional Director, Dr. Lucille Piggott. And for that, we say kudos to this awesome chapter. The town hall meeting tonight with state officials from the North Carolina Department of Health and Human Services, and we say thank you to each one of them who have sacrificed their time and expertise to be with us on this evening. Our world has been tremendously impacted. Our state has been tremendously impacted by COVID-19 for the past 9 weeks, and Alpha Kappa Alpha has made it a priority to ensure that the health and safety of our members, as well as the communities that we serve, are certainly protected. We know that this virus has impacted you personally, and I am elated that you have taken the time this afternoon, this evening, for the opportunity to provide more information as the state of North Carolina moves into phase 2 on tomorrow, which is a very scary thought. My friends, I urge you to listen and learn about the precautions we all need to take, as we already see some reckless and dangerous activity that can uptick the mortality rate in North Carolina and the world. Again, I greet you on behalf of the Mid-Atlantic region of Alpha Kappa Alpha Sorority Incorporated, and hope that you will learn something that would help you survive this COVID-19. We hope that you will have an awesome end of spring and a great summer. Blessings to each one of you, and thank you to our partners from the state. God bless.
Thank you, Ms. Jennifer King Congleton, for that outstanding greeting. I am Anissa Bledsoe, Vice President of the Beta Omega Chapter of Alpha Kappa Alpha Sorority Incorporated and Chair of all chapter programs. This evening, I am honored to introduce Dr. Michelle Laws, who has graciously worked with our chapter preparing for this phenomenal event. Dr. Michelle Laws, a Chapel Hill native, holds a BA in Mass Communications from UNC Chapel Hill, a master's in sociology from North Carolina Central University, and a PhD in social and behavioral sciences from Virginia Commonwealth University School of Medicine. She is the Assistant Director of Consumer Policy and Community Engagement for the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services within the Department of Health and Human Services. Her distinguished professional career includes serving as the Assistant Director for Community Health Coalition, Incorporated, the Executive Director of the North Carolina State Conference of the NAACP, a college adjunct professor at North Carolina Central University, North Carolina State University, and in federal and state prisons. CEO for Maclow and Associates Incorporated, campaign press secretary for former U.S. Congressman Albert Wynn, speechwriter for the late Senator Gene Lucas of North Carolina, and the legislative liaison for the North Carolina Department of Health and Human Services, Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. Dr. Michelle Laws will be followed by two of her colleagues at the North Carolina Department of Health and Human Services. At the end of the panel, Dr. Ruth Gilliam, a Beta Iota Omega chapter member, will moderate our question and answer session. Dr. Phillips sits on the Justice Warren Heart Disease and Stroke Prevention Governor's Task Force. She is also a board member of the Triangle American Heart Association and the American Cancer Society for Central and Eastern North Carolina. We now welcome Dr. Michelle Laws.
Thank you, and hello to all of the members of the Alpha Kappa Alpha sorority here in North Carolina and your leadership. And I especially want to thank Ms. Mabel Scott for reaching out to Secretary Mandy Cohen and really making this virtual town hall a reality. It is through the outreach and the input that we are receiving from organizations such as the AKAs, who play an influential role in making sure that our communities have access to information, access to services and programs that they need to overcome this COVID-19 pandemic in a very healthy and positive way. We are truly working with stakeholders like AKA to try and get ahead of the COVID-19 curve and to begin to shift or change some of the trends that we're seeing that are leading to disparate outcomes among African Americans in particular and other vulnerable populations, as well as historically marginalized populations. So it is really an honor to be here tonight. And I have with me two of my colleagues that I have the utmost respect for, two of the best minds that are sitting along with me and others at the table with the secretary, helping to provide guidance and counsel on the decisions that are being made related to our response as a state to COVID-19. So with me today, this evening, I have Ben Money, who is the Deputy Secretary for Health Services. Mr. Money comes to us as serving as President and Chief Executive Officer of the North Carolina Community Health Center Association, where he represented 41 community health centers across the state. He led NCCHCA during a 10-year period of unprecedented growth in organizations, clinical sites, and patients served. In this role, he was a member of the boards of the North Carolina Institute of Medicine, the North Carolina Healthcare Quality Alliance, the North Carolina Health Information Exchange Advisory Board, and a list of others. He also was on the advisory committee for both the East Carolina Brody School of Medicine and the Gillen School of Global Public Health at the University of North Carolina. Also, and he holds, a master's degree in public health nutrition from the University of North Carolina, Chapel Hill, and he brings deep knowledge of health and North Carolina in health services in North Carolina. And then also we're joined by my dear friend, Dr. Cardra Burns, who is the Senior Deputy Director for the North Carolina Division of Public Health. Her esteemed background, includes serving as Associate Professor at several universities and colleges, including Ashford University and Baker College. She has also served in multiple executive leadership positions in different areas across the state, including Mecklenburg County as the Assistant Health Director, also over preventive health, the health director in Halifax County for Halifax County Public Health System, and the nutrition director for Scotland County Government. Dr. Burns has taken the leadership at the state level at DHHS, in addition to her role as the Senior Deputy Director for the Division of Public Health. She has taken the leadership in helping to guide our testing activities, COVID-19 testing activities, and provide guidance on the policy side of things as we move and to work closer with our local health departments and municipalities to equip them to respond effectively to the COVID-19 pandemic. And now I think the slides will actually, I'm hoping, open up, and we will go ahead and begin our presentation. But again, I want to thank you for this opportunity. I also want to thank you and give greetings on behalf of our secretary, Dr. Mandy Cohen, who regrettably could not be a part of this virtual town hall, but is eager to hear an update, eager to hear your questions, and also, most importantly, eager to hear your advice and your recommendations on how we can best serve populations with a focus on historically marginalized populations and African American women in the state of North Carolina. So without further ado, what I would like to do now is to turn it over to Ben Money. Next slide. Ben.
Thank you. Thank you, Michelle. And thank you, President Boyce and members of the Beta Iota Omega chapter of Alpha Kappa Alpha Sorority Incorporated. It's my pleasure to be here and give you an update on where things sit with COVID-19, and particularly an emphasis on the African American community in North Carolina. And I'm sure many of you have heard and read in the media how COVID-19 is having a disproportionate impact on communities of color, and particularly African Americans. North Carolina Department of Health and Human Services was one of the first states in the nation to actually begin to tease out our data on cases, hospitalizations, and deaths from COVID-19 and make that data available publicly. So what we do every day is update our data dashboard, and that includes data on race and ethnicity. So the data that we're presenting here on this particular slide is as of May 19th, which was Tuesday. And what we saw on May 19th was a total of 19,445 laboratory confirmed cases of COVID-19. I want to emphasize laboratory confirmed cases because that's the only way that we can actually officially determine whether someone had COVID-19 or not. Now, until we were able to ramp up testing, many people that had the symptoms of COVID actually recuperated at home, and we don't have those figures. What we do have is those figures that have been reported by our laboratories, and that includes the state laboratory for public health, the commercial laboratories, as well as the hospital laboratory. So every laboratory that is involved in testing in North Carolina is reporting this information, and we're getting it updated on a daily basis. So what we can see from these 19,445 cases is actually 75% of those cases were identified with known race. So in other words, there are about 25% that we have no idea what the racial makeup of that particular case was. So we see that in North Carolina, African Americans make up about 21% of the population, but 32% of the positive cases. And for deaths, unfortunately, there have been 600, at this point, there were 682 deaths in North Carolina, and 96% of the deaths were actually recorded by race. So we have a better assurance that 35% of the deaths were attributed to African Americans, which again, disproportionately higher than the population for the state. Next slide, please. Some things that we know are that COVID-19, as was indicated by the data, is disproportionately affecting communities of color, African Americans, Latino communities in particular. And the result of historic and persistent health disparities, coupled with systemic racism, discrimination, redlining, economic deprivation, has really led to where we are right now, where we see COVID-19 as really the endemic of a situation that has been occurring across the country for hundreds of years. We also know that people of color are disproportionately at risk for more of the severe illness of COVID-19. And we can see that reflected in the death rates, such things as diabetes and hypertension, pulmonary diseases, other conditions, including obesity, can lead to greater risk of severe complications from COVID. We also know that people of color are overrepresented in frontline, low-wage positions within healthcare and the service sector. That means that every day they're forced to go to work and encounter more and more people. That means their risk of exposure goes up through this direct contact. And also these positions don't, for the most part, pay sick leave. They don't have health insurance. And so folks go to work in situations where they're actually under the weather, not feeling well, and in many instances sick. And because of these low wage positions that many instances don't pay a living wage, they're forced to take on secondary employment to maintain their income. And that, again, increases their risk of exposure. There are also social determinants of health, these things such as lack of housing or food, transportation insecurities, lack of employment, educational opportunities, coupled with interpersonal violence that actually exacerbate health inequities. One of the things that we know is that as we've promoted policies around staying at home and encouraging telework, that only 19.7% of African Americans can work from home as compared to 29.9% of whites. So they're, again, in the service sector where many of these jobs require physical labor, workers in these professions often have complications from their work. And again, that increases their risk of COVID-19 complications and exposure when they're working in the public sector. Often these jobs require tenuous childcare arrangements, and many times older family members or neighbors are those childcare providers. And that increases the risk of transmission, particularly to our elderly members of the community. One of the things that we know is that when you're living from paycheck to paycheck, that increases your stress. And living in disadvantaged, segregated neighborhoods, as well as exposure to racism, increases not just economic stress, but psychosocial stresses, chemical stresses as well. This also can increase cardiovascular diseases, obesity, diabetes, mental health disorders. We also know that there are studies that suggest that historically marginalized populations in this country experience an accelerated rate of aging, premature aging, called biological weathering. They are literally physiologically older than white persons who are the same chronological age. So your age doesn't just capture how long you live, it also captures the exposure you've had to adverse conditions and how physiologically compromised you may be as a result of that. So that can also lead to early onset of disease, as well as exacerbating the complications of COVID. We know that there are wealth disparities within the United States that play a huge factor in this, that are really divided along racial lines. We also know that when it comes to wealth, many times in our communities, it's the women that are the breadwinners and heads of households. And so placing a particular burden on women. And we also know that there are women of color that are entrepreneurs. and leading and developing their own businesses. In fact, one of the fastest growing populations of entrepreneurs are women of color. But the stress, the economic pressure of a decline in the economy, coupled with COVID, has really exacerbated what took place in 2009 with the economic collapse, where most African Americans actually have not recovered from losses that were upwards to 48% of net wealth. And net wealth really is a key factor in determining an individual's ability and resilience to bounce back from economic hardships. So we're seeing that these coupled physical, historic racism, and economic disparities are exacerbating the results that we're seeing in COVID, our increased likelihood of having severe complications as a result of the condition, and unfortunately increased deaths due to COVID. So when we look at solutions and strategies, our approach is not just looking at where we sit right now with COVID, but recognizing the fact that there needs to be systemic structural changes across North Carolina and the nation to be able to address the vulnerabilities that have essentially been manifested and brought out in the open by this COVID-19 pandemic. Next slide, please. So Dr. Cardra Burns will talk about our strategies around our 3 T's: testing, contact tracing, and trending. Dr. Burns?
Thank you, Ben. Can you all hear me?
Yes.
Great. Good evening, everyone. It is my pleasure to be here with you tonight just to talk about what we're doing around testing, contact tracing, and trending. Yes, let's stay on that slide. When we focus on the 3 T's and moving forward to get ahead of the curve, increased testing allows us to link access to clinical care. It also helps to inform public health mitigation strategies. And this is where contact tracing comes into play, and really linking testing to known contacts of positive cases so we can have that cycle of testing, tracing in order to further mitigate the spread of COVID. It also helps inform us with outbreak management in both congregate settings that has medical support, but also those congregate settings without the medical support. So for example, our homeless shelters and migrant farm camps. Additionally, it helps inform our data to really support disease surveillance activities, and that's where we're monitoring the trends of our cases. Next slide. So when we look at our local health department's response in this, as you know, with any public health emergency, our 85 local health departments are our frontline response and defense mechanism. As I mentioned in the previous slide, testing and contact tracing are integral so that we can stay ahead of the curve, and local health departments are positioned for this charge. Our local health department leaders are well versed in the needs of the community and have close relationships within their communities. They are working with various entities to increase trusted collection and testing sites, as well as connecting individuals to any social support. And I'll talk a little bit more about this in the next slide. Additionally, with COVID-19 being so highly contagious, this makes exposure outside of close social contacts harder to identify. And then again, this is where our local health departments are integral in contact tracing. Contact tracing is a core disease control measure that has been employed by local and state health department personnel for decades and is a key strategy for preventing the further spread of COVID-19. And as we learn more about the virus and how it's impacting our minority populations, local health departments are invested in seeking to change the mechanism by which social determinants produce inequities and have thoughtful emphasis on equity, as well as ensuring communities of color have access to trusted testing sources. And again, in the next slide, I'll discuss that a little bit more. Next slide, please. As Dr. Laws mentioned, I am really leading our department's COVID-19 testing capacity. And also, as you heard from Ben, we can see from the data that COVID-19 has a disparate impact in communities of color and other marginalized communities. The health disparities that we see during COVID-19 did not start with this pandemic. In almost every health measure, communities of color fare worse. The root causes of these disparities are complex, interconnected, and rooted in historical and contemporary inequities. Thus, we must be stronger in our engagement, our collaborations, and intentional with our efforts. The framework for our testing strategy has been really to, again, focus on equity and access to testing in our highly marginalized population. We're looking to build infrastructure throughout North Carolina for testing and response, particularly to emerging crises. Today, we have around 300 sites posted, testing sites posted on our DHH website. Some of those include our partnership with the federal government with Walmart, Walgreens, Harris Teeter, as well as FastMed has included 15 retail sites in partnership with the North Carolina prison employees. We are also expanding testing through a federal partnership with CVS, and they're planning to bring over 25 sites to North Carolina, and Mecklenburg County has been their first identified county. Additionally, we are being very data-driven on how we deploy testing resources, and the state and federal government are actively working to provide supplies. We've developed a process to fulfill requests for PPE, test kits, bulk swab, and just the transport media that's needed for medical providers to be able to collect specimens. And these items are free to providers, and they can request it from our DHHS website. Additionally, throughout the framework of testing, we want to ensure that all counties have sites for collection and testing, and that anyone who needs to be tested should have access. We are leveraging the footprint and the leadership of our local health departments, because it is one in every county, leveraging the capabilities of our North Carolina health system, as well as other health providers such as our FQHCs. We're also engaging other new entrants and innovators and partnerships such as you all to make sure that we can get the awareness and especially have trusted entities informing and sharing trusted information. So these partnerships, and I'm glad that we're having this call tonight, are so crucial. Just some examples of some efforts that are going on across the state, and mind you, this is not an exhaustive list, but our Office of Minority Health is in early discussions with the North Carolina General Baptist State Convention to support desire of hosting community testing events. Our local health department leaders are working with various entities, again, to increase those trusted collections and testing sites. And they're partnering with our faith-based organizations, other civic organizations, public housing as well. Our FQHCs are partnering with the Old North State Medical Society on their COVID-19 community initiatives. And additionally, the Old North State President, Dr. Charlene Green, is one of the co-chairs of a test surge work group that we created. A part of our data-driven decisions is that we conducted a detailed analysis at the county level to really prioritize counties to focus our initial efforts to boost testing capacity. The analysis did take an equity lens and a weighted score based on the presence of vulnerable populations, high-risk populations, and just data that showed under testing. And that's where we really tried to position those federal high throughput sites in those priority counties where we're seeing higher poverty, minorities, and again, under testing. Next, I will pass it on to Dr. Laws.
Thank you, Dr. Burns, and thank you, Ben, Mr. Money. I will move quickly through this, and it really connects to what both Dr. Burns and Ben addressed in their presentation. One, Dr. Burns underscored the fact that we realize and recognize at DHHS that we must be more vigilant and rigorous, as well as intentional in our testing and tracing efforts. And we can't do that. We fully know, we're cognizant of the fact we cannot do that without engaging our community stakeholders and working with the populations that we are serving. I am leading the team at DHHS, co-leading along with Janet Sullivan, the team at DHHS that is focusing on historically marginalized populations and making sure that we're communicating and engaging communities in different ways. One of the ways that we're doing it is partnering with through partnership with the Governor's Office of Public Engagement under the leadership of Jeremy Collins. I'm not sure, some of you may be familiar with their weekly broadcast via YouTube and communications that they have with different community stakeholders, including faith organizations, the North Carolina NAACP, the General Baptist State Convention, and as Dr. Burns mentioned, the Old North State Medical Society has played an integral role in helping to make sure that we are not only reaching out to communities, but the way in which we are doing that with a cultural lens and an equity lens. And participating in different work groups that include our HBCUs, historically Black colleges and universities, has also been a key strategy that we've tried to utilize to make sure that we're reaching the populations that are being impacted the most. Also through our Office of Minority Health, Dr. Burns already spoke about this, but again, want to lift up their work that they're doing under the leadership of Cornell Wright, working with faith communities, civic and community organizations, the Divine Nine, and other academic partners, including the HBCUs, doing this through disseminating information using multiple channels or methods. And that's virtual meetings such as this virtual town hall that we are very honored to be a part of tonight with you. And then DHHS's COVID-19 dashboard, which we encourage all of our community stakeholders to become comfortable with using and to use that as their number one go-to to find updates about policies and guidances as we continue to move through this epidemic. And then other things that I've been playing a central role in is our strategic communications and engagement plan, really, again, working with stakeholders from all of the historically marginalized populations, so not just African Americans, but the Latinx and Hispanic communities, American Indian or Native American populations, as well as our refugee populations. And then also understanding that we still have to work with those populations that were particularly vulnerable, including those that are medically fragile or those with multiple chronic health conditions such as diabetes, hypertension, and the like, where we see that African Americans in particular are disproportionately impacted. And Ben touched upon the stress factor and the fact that stress lends itself as another risk factor in terms of compromising immune systems. And there's a whole presentation that I do along with some others that looks specifically at stress and its effect. And we'd be happy to come back at another time and share some of that or drill down into some of that information and data as well. But also been instrumental in developing public service announcements, radio and video PSAs, identifying and using key influencers to deliver the message. Recognizing that it's not just what we do on the DHHS side in terms of messaging and creating certain engagement strategies, but the messengers are also important. And then again, really focusing on how we're disseminating the information, utilizing our website, DHHS website, making sure that it's up to date with metrics and data that makes sense, not just to policymakers and those of us on the leadership team that are sitting and giving guidance and creating guidance from within DHHS, but that it makes sense to the communities that we're trying to reach out to. And we understand that some of the barriers, such in addition to the social determinants that Mr. Money talked about, there are other barriers such as lack of trust that we are trying to navigate through and work through. And this lack of trust is based on historical experiences that we know, and particularly the African American community has experienced. So not just the well-known and often cited Tuskegee syphilis trials, but also Henrietta Lacks cell trials and cell research, as well as others, that have caused such a high level of fear and distrust of any government-led policies and responses that we are trying our hardest to work through in our communities and not let it be a barrier for them accessing the services that we are delivering to try and reduce the spread or mitigate the spread of COVID-19 among our populations, actually stop the spread. And so the challenges that we are addressing include some of that historical knowledge and experiences that historically marginalized populations have, and even ongoing contemporary experiences, people who have had negative experiences with healthcare providers and systems. Recognizing that incongruence and mismatches, for example, between providers and patients, people going to access services from systems and providers that are not culturally aware, culturally knowledgeable, and who may not understand some of the nuances that they can that can create a resistance or help create some of the barriers in terms of people accessing services as well as information. The challenges, health disparities, disparate outcomes. We know there are historical and structural inequities that we can't resolve and solve overnight, but that requires a lot of heavy lifting, because we're trying to shift systems responses, right? And so one example goes down to bullet 3. We have been engaging in conversations with minority providers, for example, who historically have not been given access to contracts at the same level or in the same way that their counterparts have. And so we're having some of that discussion about who's getting contracts, who are the service providers that we are using to deliver services, and making sure that there's an equitable representation of providers. And then service access, PPE. One of the things that has come up is often in discussions of late, even, is as we move to slowly release some of the restrictions in terms of movement. I don't want to say open up the state, but that's kind of how people interpret that. But as we move forward in relaxing some of the guidelines and policies restricting public interactions and congregation engagements, we are finding that people are pushing back, and particularly faith organizations, and saying, hey, wait a minute, we are not ready until we can make sure that we have enough PPE, personal protective equipment. We're not ready unless we can make sure that there are testing sites available to our congregation to make sure that we can rapidly respond to any of the risks that may manifest during this shift back into an open state. And then the different ways that we are delivering health, telehealth, and mobile health services. Interestingly, what we're finding are even disparate outcomes or effects as we look at that data as well. So we're finding that African Americans or Blacks and Hispanic and Latinx populations are less likely to utilize telehealth on a regular basis. So they may interact one time with a healthcare provider, behavioral or a physical health or medical provider, but they're less likely to continue utilizing that form or mode of healthcare delivery. And so we want to try and figure out how we can change that, if that is going to become a normal way or a new way in which we deliver health to to our populations. And then there are blind spots. We admit that there are things we just don't know, and we don't know what we don't know. And that's why these kinds of interactions and conversations are extremely important to us. Having virtual town halls with the AKAs and with other community stakeholders is extremely important, because you help us to know where our blind spots are and to know and understand what it is that we don't know, so that we can be better in the guidance, the policies, the practices, and the services that we are helping to shape and get out into communities to combat COVID-19. And so with that, I want to encourage the AKAs to continue. Alpha Kappa Alpha as the oldest sorority, and very influential, and with members across the state, to continue to help us, inform us in how we do outreach and information dissemination. Help us with the messaging. If there's messaging that you're not hearing that you think we need to be delivering and developing, please let us know. Testing and contact tracing, I'm sure Dr. Burns would encourage you to reach out and share any guidance that you think, site recommendations, any others that need to be engaged. We did meet today. We had that first conversation with the General Baptist Convention, about state convention, about leadership, about using faith-based organizations as potential sites to deliver testing. And so there may be others, again, blind spots that we're not familiar with, or that we simply have not thought of. And then sharing information, again, what you're hearing, and any feedback on what kinds of data we need to be collecting, right? So we are collecting what are obvious data points, and that's, the percentage of people that are getting tested, broken down or disaggregated by race and ethnicity. But what else do we need to know? What other kinds of data do you think we need to know? And there are other data, metrics that we're using. I just use that as one example. And then finally, we are encouraging that everyone help us to continue to get the word out about practicing the 3 W's, making sure that you're wearing a cloth face covering, and being very specific to communities and populations such as, African American males, for example. We be intentional and specific about the guidance that we're giving to some populations that we know may end up being profiled by police or experiencing police bias. Being very specific, we're talking about nose and mouth coverings specifically. Also waiting until you're at least 6 feet apart and avoiding close contact, and of course, washing your hands. Those are the 3 W's that we're hoping that you will continue to help us get the message out. So there are 3, we tend to do things in 3s, right? So the 3 T's are testing, tracing, and trending. And that's what we're doing on our side of the house, the policy side, the services delivery side, the practices that we are working with local health departments and federally qualified health centers to stand up and to do. But then these are the personal behavior side of things that we all need to be doing. There are some resources that we want you to also share among your members. Hope for NC helpline is a helpline that anyone can call who needs to speak with a licensed therapist, a practitioner, a mental health practitioner. These are very difficult times for all of us. And so we're encouraging people who are feeling any forms of mental health distress to make sure that they are reaching out. And this is a free service provided to anyone who calls. And then, of course, our Hope for Healers. This particular hotline is for healthcare professionals, emergency medical specialists, first responders, and other staff and their families. And then, of course, the Alcohol and Drug Council of North Carolina is a service that's supported by the state as well, that we're encouraging people, if there are signs or symptoms of people in your families, in your communities, that are in need of alcohol and drug counseling, we encourage them to utilize this service as well. And then, of course, the National Suicide Prevention Lifeline. This is especially important for all of us, but also for our children. We know that Black youth are showing or have shown the highest rate of increases among suicide ideation as well as attempts. And so we need you to make sure that our children help us, make sure that our children also know that there are resources available to help them as well. And with that, I will turn it back over to the moderator.
Good evening, everyone. There are quite a number of questions, so we're going to get started. The first question is from Maya. As students prepare to return to Greensboro, what are the plans of the health department to support university health centers in the event of coronavirus outbreaks on the various campuses, i.e. testing, contact tracing, treatment?
So Cardra?
Yeah, I was just getting myself unmuted to answer the question. Yeah, we are working with leaders now of really discussing what the opening of schools will look like for those universities in August. So we're using this time over the summer to really help prepare and decide, is it going to be a frequency of testing? Because one piece of the puzzle of testing is that it's just a point in time. So we still need to maintain our 3 W's as well. And so they are definitely coming to the table and being a part of the conversation and the planning of how we can best meet the needs of our students while keeping them safe.
Okay, I think you all touched on this a bit already. Let's see. This is from Tanya. As a member of Alpha Kappa Alpha, I would like for you to speak to us directly on collective and individual strategies we can utilize to support our communities in prevention and recovery.
So I'll take a shot, and then I think we all can speak to this. But I know Ben and I have had a lot of conversations with our colleagues and Dr. Burns as well. But I think one of the things is that you can encourage members of our community to make sure that if they are contacted by a contact tracer, that they respond and take it seriously, and that they I know there's this fear about sharing information, where you've been, who you've been with, but this information is going to be vital in helping us to make sure that we are identifying areas, hotspots, and other areas where we're seeing the spread, and so and also to intervene early to be able to mitigate and to stop that spread. So one is the contact tracing piece that I want to lift up, and I can't stress enough. And we're going to be doing some messaging around that next. We've already designed some messaging, but we're going to be doing some a video PSA around that will be helpful for you to share. And then the other thing I think too is making sure that we are practicing good self-care and that we're educating each other about the self-care, right? So I cannot overemphasize the importance of making sure that the stressors are minimized, and that the stress that we take on is at a low, because it places our immune system at a higher risk. It compromises our immune system. And there are certain things, family's gonna work your nerves, right? And even more so while we're stuck in the house with everybody, right? Family's gonna, we're gonna have family stressors, financial stressors, job stressors, all of the major stressors that lead to this compounding effect of stress that gets to what Dr. Griscom in her weathering effect identified, that sort of erodes or ages us, and also has a grading effect on our immune system as well as other organs. So really don't underestimate the importance of eliminating as much stressors as possible. So self-care is another thing. So helping us getting out the word about testing sites, but certainly about the contact tracing, and also developing messages that continues to just kind of pound in, hit home on eliminating stress and practicing good self-care, reaching out when people are in need. And then supporting where you can. I know you are huge on service, supporting where you can, organizations and even you leading some of the work around food distribution, around making sure that people have access to support systems, working with our elders and seniors and so forth. Anything?
Yeah, and Michelle, that was a very comprehensive list. And just want to just add one thing too. I think it's very important to continue to emphasize just how contagious and how deadly COVID-19 is. Yeah, I think that there's been a lot of um, public pressure on loosening society. And early on, we did a series of conference calls and webinars with African American ministers, community groups, really emphasizing just the extreme vulnerability of our communities and our people in particular to this virus. And so, you know, when there was a recent lawsuit that actually created the opportunity for churches to reopen, even though, you know, our mass gathering limits recommend no more than 10 people indoors. A lot of African American churches said, no, we're still going to do, you know, the video conferencing. We're still going to do remote services because, you know, our elderly, our members of our congregation are at unique risk, and it's not worth taking that chance. So, you know, when we talk about phase two, the theme of phase two is safer at home. We still believe it is safer at home. And so it's important to just recognize the fact that we need to continue to educate our communities about the risk and who's at risk, and really support members of our congregation, members of our communities that, or our congregations that are at high risk, so that they can have the resources, the support that they need. You know, one of the things, if I could go back in time and change one thing, I would change that term social distancing to physical distancing, because it really is about physical distancing. We want to be socially connected, and we need to maintain our communities and do that in such a way that we can be physically safe from this virus.
Okay, thank you. A couple other questions from Tanya. Are there programs in North Carolina to train people to become contact tracers?
I'll take that. Yes, I actually just dropped into the chat box
I can see it. Yeah, I see it now.
to be a contact tracer.
Okay. Well, we have a lot of questions here. This is great. What can you share about the accuracy and speed of getting test results? There appears to be disparities in getting test results in a timely fashion for minorities.
I'll take that question as well. This is Dr. Burns. It'll be good if I can get any specific areas, or if it's any specific providers. I know with our test surge work group that we have a lot of the large commercial labs at the table, and our goal has been to have test results coming back to providers in 48 hours or less. A lot of time that turnaround has been 24 hours or less, and that's when the specimen actually gets to the lab. So you do have to factor in the travel piece, and so I'm not sure if that's where the lag is, or if you're seeing a specific area that it is taking too long. And if I do get that, I can definitely check into it. If it's a certain part of the state, or if it's a certain provider that we can work with.
Okay, the next question is from Sharon. How effective are alternative disinfection methods, such as ultrasonic waves, high intensity UV radiation, and LED blue light?
I don't have that one. We can take that question back to us and get with some of the experts on that.
Yeah, I think that was probably referring to killing the coronavirus on surfaces. And we do have some information on our website about cleaning and, the proper way to provide that kind of disinfectant.
Okay. And one other viewer wanted to know, are the research articles shared? Can they be referenced? Can you share those with us? The research articles that were referenced.
Yes, we absolutely can. I think what we can do after this, Ben and Carter, and Dr. Burns and I can get together and put together a list of different things that we've referenced, as well as the links to the guidances on our website, and share that with you.
Okay. Are there a lot of youth getting this virus?
Hey, this is Dr. Burns. I can take a stab at that question too. We're still continuing to learn more about the virus. Initially, when COVID-19 first came, awareness of it, children was at a lower risk. However, it does not mean that they are not at risk of contracting the virus. So we still should be mindful of the preventive efforts for everyone, including children.
Is it a good practice to wear a mask when you are in common areas at work, such as the mail or copy area or break room, etc.?
I can take that question again. I would say masks should be used if you cannot social distance. So if you're in that common area and you cannot socially distance for 6 feet, then you should consider having a mask on.
Is there any discussion about Medicaid expansion with so many people out of work and living without medical or dental insurance?
We discuss that every day. Of course, that's at the top of our list of the way that we, even in looking at a way that we could have gotten ahead of this was to make sure that everyone had access to health insurance coverage, meaning that they would have had access to health care. And so we still say that Medicaid expansion, it makes no sense for us to be one of the few, I think we're one of 13 states, I think it is, who has not expanded Medicaid. We also, on the unemployment side of things too, we do know that there's been some talk in terms of providing emergency services or health care service to those who are impacted due to COVID-19 in terms of their employment status. Because most people, their insurance who are not Medicaid eligible, their insurance is tied to their employment. And so we do know that that is an issue. But we also want to say that we have a house divided in North Carolina in terms of government. So we've got, as everyone knows on this call, we've got a Democrat-controlled governor and cabinet, and then we've got a Republican-controlled House and Senate. And so we're hoping that we can see politics being put aside and the focus really being on what can move our state forward in terms of the health of our residents. And part of that will be ensuring that everybody has access to health care.
Okay.
And I think that's one area you can clearly lend your strong and powerful voice to.
Okay. Many state and local workers don't seem to understand that health disparities around COVID are due to historical injustices. What is the department doing to address this? I think you touched on this a little bit.
Yeah, well, actually, we are doing a lot in terms of this effort. We're really trying to put a very singular focus on being mindful of where we sit with the data and addressing our resources towards that area of disparity. We recognize the fact that, as I said before, these are historic inequities. And this period in time with COVID has really revealed what was already there. But we need to make sure that we have a very concerted effort towards services and resources that address not just COVID, but what will likely be some of the lingering effects of it. And Michelle is very engaged in the work of the department in that focused effort.
Okay. How will local human service agencies be supported in the recovery aftermath as we move back to a sense of normalcy? How will contact tracers be used within the community specifically?
So, one of the things that Ben and I have been looking at is the use of contact of community health workers, and on my end, on the side of the house, I say that we are, which is mental health development and intellectual and developmental disability side of things. We are strong proponents of the use of peer support specialists. And so beyond contact tracing, you're going to need people who are still making sure that folk are connected to services. And people are making sure that they're engaging in treatment plans and so forth. Remember what I said about the use of telehealth services, for example. And so in addition to contact tracing, which is specific to COVID-19, the effect of the virus and the contact, to making sure that we are aware of how it's spreading, we also know that we've got to lift up community health workers and peer support specialists to stay engaged in these communities that have been hardest hit and working with these populations that have been most disproportionately impacted. And so those are, historically marginalized populations, including African Americans, Latinx, refugee. We've got a huge refugee and immigrant population, which we discovered is beyond just the Spanish-speaking populations. In one of the outbreaks at one of the plants, the meat processing plants, we discovered there was a large percentage population of Swahili-speaking African refugees that have been brought over here through different means, and are being used working in some of these plants. In Mount Olive, for example, there's a huge Haitian population. And so we know we're gonna need to send out community health workers, just like we do, and we see it happening from a global health perspective when we're responding to Ebola or malaria, and we send community health build up and send out community health workers. We're going to have to do the same thing in our communities here in North Carolina.
Okay. Can COVID-19 be transmitted through sexual relations, since it has been stated that the virus is found in body fluids?
So this is Cardra. I am not aware of, I cannot speak on that answer to that question. I can confirm with our epi specialist and bring an answer back to that.
Okay. Whenever a vaccine becomes available for COVID-19, if I were to receive the vaccine, can I still get the virus?
We don't, this is Carter again, we don't know enough information to be able to answer how the vaccine will work and when we will have a vaccine to be able to.
Okay. Why has it not been mandated by the state to wear masks in businesses and workplaces?
You want to take that one, Ben?
So in the phase 2 guidance, there's recommendations, but the mandate has actually been for those personal care services. So when an individual is like doing hair, doing nails, they need to have face coverings. It's always important to remember that the face covering is really to protect the other person from fluids that may emanate from your nose or your mouth. It's not necessarily a protection for you. But if both people are wearing that, particularly if they need to come within that 6 feet distance, there's a greater likelihood of protection from the virus spreading through the air, because we know that it does spread through water, through droplets in the air, airborne droplets.
Okay, thank you. We have one last question. We have time for one more question. We have quite a few questions left, but have we seen any NC North Carolina children with multi-system inflammatory syndrome associated with COVID-19?
I can take that. Yes, we did announce today that we had our first reported case in North Carolina. The child's at home and doing well, but yeah, we did announce one case today.
Thank you so much for answering the questions. We had many participants. We appreciate all the panelists. There were a couple great responses. People really enjoyed the feedback. Thank you so much.
Thank you all.
Thank you all. Thanks for the invitation. Thank you.
Thank you for joining this engaging and enlightening town hall hosted by the North Carolina Department of Health and Human Services and Alpha Kappa Alpha Sorority Incorporated Beta Iota Omega chapter. We would love to hear your feedback and have put a link in the chat for you to complete a brief survey. We would greatly appreciate it if you take a moment to do that. I'd also like to give a special thank you to our Mid-Atlantic Regional Director, Jennifer King-Congleton, our presenters today who've done an amazing job, Dr. Laws, Mr. Ben Money, Dr. Cadra Burns, and to Dr. Mandy Cohen for her leadership during this pandemic. A special thank you to Anissa Bledsoe, Dr. Mabel Scott, Tiffany Temple, Geraldine Brown, Ayana Hanger, Relita Dawson, Geronda Pulliam, Dr. Ruth Phillips, and to all the members of the Beta Iota Omega chapter of Alpha Kappa Alpha Sorority Incorporated for their role in executing this town hall tonight. Again, thank you for joining us tonight. We hope that the information was informative and will help you sustain during this time and the next phase in our great state of North Carolina. Good night.